Bismillahirrahmanirrahim. I am Dr. Ayesha Rais, BDS FCPS in Oral and Maxillofacial Surgery, MS in Public Health. The topic that I am going to present today is mental health, a silent global crisis. Now let's see what mental health is. It is a state of mental well-being that enables people to cope with the stress of life, realize their abilities, learn well, and work well. This is what the WHO says about the mental health. There's not a single factor that is causing this mental health problem. There are multiple factors like the biological, psychological, social, environmental, and the lifestyle. And we should work on it. Do you know why we are discussing this? Why mental health matters? As the data shows that 1 in 8 individuals globally is affected with this condition. This is what the WHO data says. And 970 million people worldwide live with this condition. This is the leading cause of disability worldwide, and half of the mental disorders start before the age of 14. And it is overlooked and underfunded globally. As the figure shows, which is a data and the survey taken from 31 countries in 2024, that 45% of population is affected with this mental health condition, which is followed by the cancer, stress, obesity, drug abuse, and many other. So it means that it is very alarming to think about it and to work on it. Now let's have a look how mental health status impact globally. As the World Mental Health Congress Barcelona 2025 shows in this chart that their depression and anxiety are the most common conditions. More than 700,000 deaths per year seen because of the condition. More than 75% remain untreated. This is the leading cause of years lived with disability. COVID-19, conflicts, humanitarian crisis, all these worsen the burden of health conditions. Less than 2% health budget is allocated, which is very less. And there is a need to integrate this into a primary care. And all this is very important to bring into consideration. Let's have a look on mental health in Pakistan. The Imran and et al. Done the study in 2023, which shows that depression and anxiety is the most common condition. Estimated 24 to 34% of Pakistan is suffering from this. The suicide is rising day by day. There is a severe workforce shortage, and only less than 1% psychiatrists per 100,000 population is there. Low treatment access to the majority of people, and they remain with this condition undiagnosed and untreated. Underfunding is one of the most important conditions, that only less than 1% of the national health budget is allocated to mental health, limited to service delivery, rehabilitation, and prevention programs, and this must be addressed. Dental hygiene are also playing a role in mental health. Poor oral hygiene, dental pain, periodontal problems, poor oral health, mental stress worsen with these conditions, and there's a stigma and financial burden. The longer you are staying with the disease, the more financial burden and more dental needs and more mental health conditions. May is considered as the Mental Health Awareness Month, and we should make people aware that this is a mental health condition, not a disease. We have to fight with it, neither to live with it nor deny it. The impact of oral health on mental conditions is given by the Lancet on call. They show that 30 to 55% depression is death. Anxiety is in 25 to 40% of the patient. There is a functional loss, disfigurement, chewing problems, and the speech problems that leads to low self-esteem and social withdrawal, pain, and treatment toxicity is so much that increase to the psychological distress. Mental health issues leads to poor quality of life and reduced treatment adherence. In Pakistan, limited psycho-oncology services result in unmet needs and poor rehabilitation outcomes, which need to be addressed. The management of mental health is important for today's presentation, and to see how it is important to have a healthy lifestyle, to have a good sleep, balanced diet, exercise, practice stress management with meditation and relaxation, build social support with the family and friends, seek professionalism with the psychotherapists, psychologists, counselors to have good counseling, therapy, medications, and engage yourself in self-hobbies and self-care. That is important because silence and the stigma are deadlier than the disease itself. Now, I would like to conclude my presentation with the solution and way forward given by the WHO. That is to integrate the mental health in primary care, increase mental health workforce, raise awareness, and reduce the stigma. Community-based support programs should be introduced more and more. Digital health platforms should also be introduced. Government and institutional funding need to be encouraged. Pakistan faces a silent mental health epidemic, which is a storm affecting millions yet largely ignored. As a clinician and a public health professional, it is my duty to lead the fight against the mental health crisis. Thanks for your time. I'm here for you any query. Today's takeaway vision is investment in mental health is investment in productivity and peace, which does not only mean to support financially, but it is the care support that needs to be provided from the family, community, and early medical care.